Today I'm going to be showing you how to foam roll the TFL and IT band. What the TFL does is it accelerates hip flexion, abduction of the hip, so bringing the leg away from the midline, and it also assists in internal rotation of the knee as well, which is going to be very important because we're going to use that action to identify exactly where the TFL is. So the TFL originates posterior to the anterior superior iliac spine. So this bony protuberance on the pelvis, you're going to go right below that and a little bit to the side, and that's where it is. So that's where the muscle belly of the IT band is. The muscle belly itself is the TFL, Tensor, Fasciae, Latae, and then the IT band itself is actually on the lateral portion of the leg. It starts on the proximal 1/3 of the femur and then goes all the way down to the lateral knee. And that's actually just connective tissue. That's not actually like muscle. The only muscular part is the TFL, and that's what we'll be rolling on. So to identify exactly where the TFL is, before you get on your roller, I want you to put your hand on the anterior superior iliac spine of the pelvis, and you're going to internally rotate the knee. So right here, and you can feel it contract and you can feel it fire up. So it's only this big, and that's where we're going to be rolling on. So when we get started here, so if I'm on the anterior superior iliac spine, I'm going to go right underneath that, relax. So it's kind of a similar feeling to when you roll on the quad, but it should be different. So your leg will be, the bottom leg will be straight, your top leg will be bent, because you're going to use that to push yourself forward and down. So we're going to hang out here for about 30 seconds. And move downward slightly. And again, it's a very small muscle, so we're not moving much here. Always keep that bottom leg relaxed. There we go. Now you can roll on the IT band as well, but if you do, you're going to have to go over the greater trochanter of the femur, which is the outside of your hip bone, pretty much. So I would take some pressure off up here because you're just on bone and that's going to be painful. And then if you roll on the side of the leg, I have a trigger point here. Just make sure that you don't roll on the knee itself.